But maybe now, dear colleagues, we can share our experiences on those topics that we were talking about, and maybe somebody would like to reflect at once what has been said and have your own insights on that. Please, floor is yours.
Good afternoon. My name is Agostinho Souza. I am from the International Federation of Medical Student Associations. And this is one of the topics that really interest the youth right now. Because there is one thing that was not mentioned, that was, or it was a little bit mentioned, that was unemployment on youth, the 50% of unemployment. And I also want to talk about the changes on employment for healthcare workforce that are from 25 to 35 years old. Because right now, what we are seeing in Europe is a huge migration of healthcare professionals from countries like Romania to countries like to Germany. And there is not a balance of policy making in Europe that addresses this problem, because we are seeing the movement of professionals from one area to the other, and we are not seeing the consequences. And the quantity of healthcare professionals, that is also a factor for human behavior and employment, is not being addressed. I can give an example. In the first Global Forum on Human Resources for Health, this was really mentioned. By improving the number of healthcare professionals, you can have one paradox, that is decreasing of healthcare professionals in your own country. Why? Because by increasing the number of healthcare professionals, then usually the wages drop, the conditions of the workers drop, and those workers are forced to migrate. And for example, we didn't talk about the effects of the crisis on the healthcare professionals themselves, the suicide rates, how they are coping with those conditions, with the new conditions. And those factors are also important, because if the health workforce doesn't have conditions to work, then the patients will not receive the best treatment, because this is the main factor. Everyone is people. The health is not a product. Like the human is not a product, is not a number. And the policies that we are talking about will get influence in the microsystem and in the macrosystem. Thank you so much.
Thank you. Would you like to reflect? I know how to turn this thing on here. Yeah, I think this is a very valid point, and basically, I think all the pillars of the EU. One of them is that people can move from one country to another, and they can settle where they want. And then the spin-off from that was what you then do with the health professionals, what you do with the doctors that want to move. And they were supposed to be able to move as well. But this is the consequence, that you actually, if you have austerity measures in one country, it will either mean that you burn out the doctors and the medical students that are left behind, or you are left with not a viable healthcare service. So these consequences are so obvious, and they've been, pointed out for a long time, of course. And it is obvious that any measures taken in any of our countries will have consequences. And I think the only way is to just open your eyes to it. I mean, if you cut down the wage of doctors because the doctors are so well off, they're not, come on, not compared to many other professions, not compared to their length of training, and the responsibility that they're not in most of our countries. If you cut if you reduce their, or make their working conditions worse, that is contrary to the Working Time Directive that has been accepted by all the countries, but is not being carried out. So you are left with the doctors who are working more, with worse conditions, with less pay, a removal of like study leave, which is really to the detriment of the patient in the end. So really, I mean, I think any policy advisor, any policy maker in Europe, any politician has to look at it in this way. It's not being selfish of the medical profession to say it. It's just to try and open the eyes to reality. And this is what we were talking about.
That is why the Minister of Health is always very much faced with the challenges of such questions, because Minister of Finance could take decisions on austerity, and the Minister of Health has to suffer because of that. Yeah, who else would like to join our discussion? Yeah, please.
Yes, thanks very much. I was very interested on the analysis of the impact of the crisis that you've carried out, and obviously with the connections with the impact, particularly on suicide rates. And I just wondered if how much, because obviously what you have there is correlations primarily, so the causal links are always the issue. And I wonder how much you've been able to go into the detail of it, because obviously, for example, you say a link between unemployment and suicide rates, but obviously it's more complex than that. It's unemployment and probably lack of social protection systems. You know, that sort of level of detail in doing the correlation, because that seems rather important. And how much that's backed up by survey material, because I think these are the sort of things when it's really important to dig deeper and to be able to know really what the causal links are and why it's happening. And I think there's a real lack sometimes. I think there's an over tendency to look at quantitative data and not to try and use the qualitative side of it to really bring it out. The other point is that I just wondered if you'd also made some, because you talk about Iceland, but obviously Norway and Sweden also went through a crisis in the 90s. So have you done some comparative work to there? Because that would be very interesting as well, when to pull it out. And finally on Spain, Spain seems to have a lower suicide rate, or less than you'd expect. Is there any points on that? Any thoughts you have on that? I mean, is there issues around social capital? Just a little bit more, so the depth of the discussion, really.
Thank you for your observation. Marina, would you like to reflect now or later?
I think that could be a very long discussion, actually. Definitely, yes, when using yes, when using qualitative methods, it would be great, and I agree most of the research I presented was using quantitative data, but also a lot of it is individual level research where a lot of other variables were controlled, actually, so it was reflecting specifically those associations of changes in the economy and the impact of health, so measured in mostly unemployment and typically suicides. But a lot of this actually takes into account other variables. And the other question was related to the Scandinavian countries. There are quite a lot of studies actually done on the recessions in Scandinavian countries, and I believe what they show was that although there wasn't impact, for example, on suicide in Sweden during the crisis, there might have been an increase later after the crisis. This is one of the studies that I remember came up just recently, so I think it is quite interesting to look at these kind of things. And another point was about the low suicide rates in Mediterranean countries. Indeed, yes, they are very low. They are lowest in Europe, in Spain and in Greece. But we are talking also about quite big increases, especially I'm talking about Greece. And two possible things. One is this is a genuine increase, and it is backed up by the data from the helplines and by the data on suicidal ideation, because there are similar increases. But also, potentially, we could say that it started being registered better, because, for example, a country like Greece is population is very orthodox country, and it might be that there are some problems with recording suicides accurately. So that could be that. But generally, yes, in these countries, rates are low. So we do see an increase. Usually it's what we report, these are statistically significant increases even from the lower base.
It's a long discussion, seems. Who else would like to reflect? May I also ask, Marina, on your studies, you found that certain countries that haven't implemented IMF conditions and they were not facing them, so it seems that they are performing better, and Iceland could be the example that they just refused to have those conditions. But other countries who didn't, seems they suffer now. Would you like to say that IMF conditions are wrong?
I think that suggesting that in the times of crisis imposing austerity on the country is actually, yes, wrong, because it slows down growth, and this is what we hear from many economists, including Paul Krugman.
Yeah. Okay, so who else would like to discuss? We have some more time. But if not, I think we had quite a long day today. Oh, yeah, come on, we have the time.
Thank you. I'm just interested in comments made by Katrine that some of the implementation of austerity has led to violations of the Working Time Directive. And if that's the case, has anyone tried to challenge these countries from a legal point of view? And if not, why not? And if so, what was the outcome of those particular challenges?
Not to my knowledge has it been challenged. I think it's just coming to light now, more or less. And you see it in the medical profession, you know, like the representative of the international medical students just said. The doctors, like in hospital, are working longer hours, and junior doctors are fewer because of this less recruitment, or they emigrate. I think this flux, I mean, it is still so fluid, and it's difficult to say how it will end. But certainly the Working Time Directive is not being implemented everywhere, and it needs to be challenged, and I agree with you there. But just on the Icelandic note, I mean, the morality, the feeling in the country was a bit like Dario Fo, we won't pay, we won't pay. You know, that was the name of a play by Dario Fo.
Yeah, International Students Association wants to reflect to.
Just to reply to that question, usually what is happening in some countries is that the careers are not being created. So the doctors are being contracted by services, by the skills. So they say you have to provide 100 consultations, or you have to stay in the hospital. And usually the doctors do the number of hours, and then there are still a lot of patients in the room. And that is an humanitarian service against, like, what is your work? And that's the perspective that the economy itself doesn't have, because a lot of times the doctors are humans that are dealing with humans, and they want the best of them. And the second point is, it's more cheaper for a government not to have careers, because then they have to pay them social benefits and so on. It's a lot cheaper to pay by service. And in the end, you pay by service and they don't count the number of hours because they work in different places. So that's one of the main problems, I think so.
Yeah, thank you. Thank you. Does anybody want to join us more? Okay. I think we had a wonderful day with our first part of the day and the second, and our reflections. I understand that it's late evening and we are tired today. So I would like to thank all our speakers for your insights and your mind and thoughts that we gave, and also for all participants. And we would like to invite you to our gala dinner today, and we would be very pleased to see all of you tomorrow. Thanks a lot.